Patients with a history of PCI represent a sizable subgroup that might benefit from the addition of ticagrelor to aspirin and derive benefit on ischemic events without too much harm on the bleeding side. As you know, THEMIS was in fact, the largest randomized trial ever done in diabetes in patients with stable coronary artery disease, looking at whether ticagrelor compared to placebo would add benefit on top of aspirin in preventing CV death, MI, and stroke. What the main trial found was a 10% reduction in the primary composite of CV death, MI, and stroke at the expense of increased major bleeding and also increased intracranial hemorrhage. We hypothesized in a pre-specified analysis that patients with a prior history of PCI might have a more favorable benefit-risk profile. The reason being that patients with a prior history of PCI have been exposed to protracted treatment with dual antiplatelet therapy and presumably have tolerated it without major bleeding, otherwise they wouldn't have been offered participation into the trial. So we looked at this fairly sizable group of patients who had a history of PCI. These represented 58% of the total trial population, more than 10,000 patients. It's actually much larger in itself than many full-scale clinical trials on their own. What we found is that, indeed, treatment benefit appeared slightly greater in patients with a prior history of PCI, with a 15% reduction in CV death, MI, and stroke compared to 10% in the overall trial. There was increased major bleeding in that population as well, albeit maybe to a slightly lower extent, but very importantly, there was no difference in fatal bleeding, 6 events in both arms, and no difference in intracranial hemorrhage, 33 events versus 31 events. And this was a statistically significant interaction with a history of PCI. And therefore, our main observation is that the benefit-risk ratio, as measured by our pre-specified definition of net clinical benefit, looking at all-cause mortality, myocardial infarction, stroke, intracranial hemorrhage, or fatal bleeding, was significantly improved in patients with a history of PCI with a highly statistically significant p-value, whereas there was no net clinical benefit in patients without a history of PCI. And again, the p-value for interaction here was 0.012. So there was a significant interaction validating our hypothesis. So our message is that in patients with a prior history of PCI who have tolerated prior DAPT, who have diabetes and stable coronary artery disease, ticagrelor represents a new therapeutic option for selected patients at high ischemic risk and low bleeding risk.